Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today I would like to share with you one of our previous patients. His name is Ramsey. He's 23 years old. I specifically choose this case because sometimes we are always talking about Norwood 4, Norwood 5 or more stage patients, but this patient is a little bit more lowering hairline surgery. So that's the reason it's interesting to discuss this patient as well. So the patient came to us about filling the both temple parts and just lowering a little bit the hairline together. So we plan according to that. But let's check first that the photos that he sent to us. As you see, the right side receded more actually. There is a thinning, weakening of the hairs, including the right temporal part and the left temporal part, but more prominent with the right side, I think. When we do the planning, I will show you as well, but the other parts looking very normal according to the photos. So probably if the patient was asking to me how many grafts it's going to be estimated, it will be around 1,500, maybe 2,000 grafts, but in the end we ended up with 2,150 grafts. With these kind of patients, usually we do something different than the other parts because usually we start with extraction with most of the patients to see how many grafts we are capable of extracting. But with such kind of patients, we wanted to do the incisions first to see how many grafts he needs, then we target that graft number. So it's a little bit more conservative approach for us. As you see in the planning photos, also its right side is more baldy and more graft needed. Actually, his frontal part needed as well. In these kind of patients, if the patient is ready to do that, we want to include his hairs in the hairline to give the best natural result, because even we do our best with the angle, direction or graft selection, the hairline could be a little bit unnatural according to the graft caliber as well. That's the reason it's better to include them inside. Yes, if the patient wants to lower it too much, at that time we can't do that, but I think we try to do with this patient. So his left side is more suitable for that, but right side needed less actually. Okay, so let's check with the shaven ones. The shaved photo, you can see something different. That happens to most of the patients. When they request something as a surgical planning from us, they think that it's a small area, but once we shave it, we see some transition of the bald areas to the hair areas. So as you see, it is larger than it seems in the unshaven one. That's the reason it needed more graft actually than in the photos that is evaluated. Let's check his transplantation photos just after the operation. As you see, right side is more graft used. Also, we are able to see some gaps when we are doing the incisions or implantations. If we see some hair gaps in those areas, we wanted to do something without damaging the existing hairs, because it is the start and onset of the hair loss at there. It's a good prevention. Of course, if we do sometimes unshaven one, we are not able to do that, but if the patient is ready for shaving his hairs, which this patient I think did the right thing about shaving the hair, so we did more areas actually. Good that this patient sent us his photos every month nearly. I'm not going to show you each month, but I just want to show you some months that is important. Let's see the first month photo. Yeah, most of the hairs shedded already. We see more right side area. It's more redness, which is very normal in these months because the hairs are just fallen off, and there's a circulation in that area, which is a regenerative and recovery period. So that's the reason it looked like that. Let's see the third month photos. In the third month, we usually expect to see some growth sometimes. Sometimes it could be delayed until the fourth or fifth month as well. But in this patient, I think we can see that it's filling right now. The left side filled more, right side filling a little less because it's a larger area. You can see in this photo as well, the same thing. And his donor area started to be recovered. It's getting better and better in other photos, but it looks okay, I think. So let's see the 6-month photo. In the 6th month, we usually want to see some growth, sometimes even like the final result, but it's very less likely. But we started to see some growth. It could be a little bit thin, which will be thickening in the following months. But in this patient, for example, yes, I think it is still thin. Those thin appearance is sometimes looks like it's very straight. I know, but it's going to be better in the following months. Let's see the 9th month photo. Now it looks like better. According to the photos, you can see that there are irregularities. There are already his hairs as well, so he has a thick, thin hairs combination. But it looks like it is okay. A good result. From left side, if we see it, it's very not noticeable actually. You can't understand or notice that he has a hair transplantation. Let's check the other following months. Okay, that's the 12-month photos. It looks okay. It's very dense. By the way, in this kind of restorations, it's very hard to make the same density with the existing hairs. So it's a very critical thing. Patients may think that it's a smaller or a quicker hair transplantation, but it's not like that. If there is a restoration just for the whole frontal area, we adjust the density. So whatever we do will be just growing. But in these patients kind, because there is a huge density behind, we need to catch the same density. So we need to adjust the right density. Otherwise, it will look very weird in the front, very unnatural because of the density, low density. So it will look not very natural. So it's very important to maintain that area. I think we just did with this patient, so it looks like it doesn't. It is not a very hair transplanted patient just for the frontal part. It looks okay. It's very dense. The density looks very good, and the patient is very happy with that. These are our evaluation about the 1-year result of the patient. If you still have some questions, you can write below and we would like to answer them. Just hair loss or hair transplantation, we are always here to answer everything. Thank you for watching us. Have a nice day.